A short wrap is a very useful hydrotherapy wrap. It involves wrapping the patient in a cold blanket from the axilla to the mid-thigh. Indications for this treatment include respiratory complaints such as bronchitis, asthma, colds, and flus. It's also good for pneumonia. And it is also good for digestive, neurological, and reproductive complaints. The wrap takes about 20 to 120 minutes for the patient to warm the cold sheet up, usually going from cold to neutral to then warm in a vital patient. Contraindications include a patient that is not vital, such as a patient with certain chronic diseases, as well as patients with skin conditions that are exacerbated by moisture.
Okay, so today we will be performing the short wet wrap. We begin by taking the patient's vitals. Okay. Relax, neutral body weight. There you go. And both feet are flat on the ground. One 10/60. Okay, now that we've taken blood pressure, now we'll take pulse and oxygen saturation. Okay, 99 and 66 beats per minute. Then we'll take temperature. Okay, 98.9. Then we'll begin by having the first layer of the sheet soaked into cold water. So here we have a tub of cold water. We'll have the patient in a patient gown, and they'll undress maybe in their underpants before they begin. So you want to wring out the water. Are you ready?
Yes. Not really. Just a couple breaths.
Okay. So now that the water's been wrung out, we're going to cover the patient for privacy. And go ahead, when you take the robe off, lift up your arms.
Okay. Give me a second.
Okay. And then turn. Okay. Now you can go ahead and lay down here. And then we'll wrap the second layer, making sure the patient's fully covered from the axilla to the mid-thigh. So the first layer is a sheet, then we have a wool blanket, and the third layer is a warm blanket. Go ahead and put your arms in. Okay, and then do you need a pillow?
Yes. Please.
Okay, so we're going to cover you forward here. patient's been wrapped in the 3 layers, then we will take temperature and also check with our hand to see if they're warming up the wrap every 10 minutes. Okay, we're still at 98.9. Then I'll place my hand in the wrap, and the wrap has a neutral temperature. Okay, once the patient's warmed up the wet wrap, then we will unwrap the patient and recheck vitals.